This video is part 2 of Chapter 2, Neuroscience for PSY 110S, the Psychological Sciences. In this part of the chapter, we're going to start by covering the neurotransmitters. Neurotransmitters, just to refresh your memory, are chemicals within the nervous system that are, their major function is to transmit information from one neuron to the next. The neurotransmitters that you see here are the major ones that you're going to cover in this part of the chapter. You have acetylcholine, dopamine, serotonin, norepinephrine, GABA, glutamate, and the endorphins, all of which are neurotransmitters. We're also going to talk briefly about various drugs and poisons that can either increase or decrease the activity of neurotransmitters. Some of these are called agonists because they increase the activity of a neurotransmitter or neurotransmitters, whereas antagonists are drugs or poisons that decrease the activity of one or more neurotransmitters. Now you may be asking, why are we talking about drugs and poisons? Well, researchers have a lot of different avenues for figuring out what various neurotransmitters do. And one of those avenues is looking at the way drugs are active within the nervous system, because it can show you by either enabling or disabling a particular neurotransmitter what the impacts are on not just the brain and the nervous system, but the entire body. So we'll start with acetylcholine. You might be, if you're terrified of spiders, I apologize, but the picture of this particular type of spider is relevant here. Acetylcholine is a neurotransmitter that's heavily involved in learning memory, but also in muscle movement. Some toxins like botulotoxin, which is, it becomes a poison. It's also used in cosmetic procedures, such as Botox injections, where what you're doing is taking advantage of the fact that botulism or botulotoxin is an antagonist that blocks the release of acetylcholine in muscles. So in the face, for example, when you have wrinkles that are related to aging, you can have Botox injections that will basically disable the muscles in the face that can cause that kind of wrinkling around the eyes, or particularly between the eyes. Also, some treatments for chronic migraine may involve Botox injections to certain areas of the head and neck that may in fact improve outcomes for people with that condition. There's also curare, which is a drug that is an antagonist, again, for acetylcholine, that paralyzes the body in a terrifying way by blocking the receptor sites for acetylcholine, and it prevents then the neurons from carrying those messages forward. And then finally, the black widow spider pictured here, the venom is an agonist for acetylcholine, and what that causes is a flood of acetylcholine into the synapse, which then causes intense pain and a variety of other symptoms. Now, acetylcholine, as it says here, heavily involved also in learning and memory and the consolidation of memory. Most of the toxins that are covered here have their most direct impacts on muscle function, but other kinds of drugs that are in development for especially the treatment of disorders like neurodegenerative disorders like Alzheimer's or Parkinson's. Some drugs that are being developed are designed to try to improve memory function. To date, we don't have a lot of effective medications in that space, but certainly research is continuing there. Dopamine is a neurotransmitter that's related to arousal, which is a generic term that relates to attention, the degree of emotional arousal, focus, and things like that, and also mood. It's been hypothesized to be related to a variety of mood states, but most particularly anxiety and depression. It's also related to thinking, to cognitive processing, and has some impacts on physical movement as well. Dopamine systems in the brain are heavily connected to what's referred to as the reward centers of the brain, and reward pathways in the brain. So one of the things that we know about dopamine is that it's connected to motor control and hormone releases. So it's, really kind of tied into the endocrine system as well as the nervous system. Low levels of dopamine are connected to diseases like Parkinson's disease. And on the flip side of that, excessively high levels of dopamine are associated with the psychosis symptoms of schizophrenia. Now, it may seem bizarre that those two things would be related, Parkinson's and schizophrenia, but it shows you sort of the difference in outcomes when you have either extremely low levels of dopamine versus extremely high levels. L-Dopa is a drug that was discovered somewhat accidentally to be effective in treating Parkinson's symptoms, primarily treating the motor-related symptoms like tremors, and the sort of facial masking that can show up in Parkinson's disease. L-Dopa is a drug that is an agonist, meaning it increases the production of dopamine, because one of the things that happens in excuse me, in Parkinson's disease is that you lose the capacity for dopamine activity in the brain. Some antipsychotic drugs are direct antagonists that block the receptor sites for dopamine. The theory is that in schizophrenia and related conditions, that dopamine levels are simply too high. So the theory is that in schizophrenia and in bipolar 1 disorder or in schizoaffective disorder, where you have active hallucinations and delusions, those have been hypothesized to be connected to excessive levels of dopamine. So many of the antipsychotic drugs block those receptor sites for dopamine, and that has been shown to effectively, in many cases, reduce or eliminate the experience of hallucinations and delusions. In some other ways, other kinds of drugs like amphetamines, including methamphetamine and cocaine, have impacts on the dopamine system, especially the reward system. So some of the stimulants that are addictive, like methamphetamine, amphetamines, and cocaine, they are, the amphetamines are agonists. They stimulate additional releases of dopamine, and that, it's psychologically very rewarding. It's a very powerful experience of euphoria and intense activity that is so rewarding in the case of those drugs. Same goes for cocaine, although its action is to block the reuptake of dopamine. So the dopamine is released and it hangs around longer in the synapse so that more of those receptor sites are engaged. In addition, some kinds of painkillers and, the ubiquitous caffeine and nicotine have dopaminergic activity. For the most part, they increase access to dopamine or increase levels of it, so that we experience those medications, those chemicals, as rewarding. Serotonin and norepinephrine are related neurotransmitters in that they both have a connection to mood, particularly depression and anxiety, as well as some of the related kinds of arousal states like sleep and eating. these neurotransmitters have been hypothesized to be very strongly related to mood disorders like depression, bipolar disorder, and also I will add to that connections to obsessive compulsive disorder and related conditions. A major class of medications that have become very ubiquitous in the United States are selective serotonin reuptake inhibitors. And basically what these drugs do for some of the people who take them, and I will, be very clear here, these drugs tend to work very well for people who have moderate to severe depressive illness and moderate to severe anxiety. Where they are not as effective is with people who have mild depressive symptoms or mild anxiety symptoms. So if you read something or you hear something on social media about this idea that antidepressants, SSRIs in particular, are ineffective, there's a problem there because they are so widely prescribed, and prescribers are not being particularly selective when they are deciding who might benefit from these medications and who won't. There's also a class of antidepressants called selective serotonin and norepinephrine reuptake inhibitors. And here, these drugs work on both serotonin and norepinephrine. The norepinephrine part tends to, particularly for people with moderate to severe depressive illness, it can have an energizing effect, improving wakefulness, improving attention and focus as well. GABA and glutamate are primarily involved as inhibitory neurotransmitters in the nervous system. And by inhibitory meaning, blocking or controlling levels of arousal within the brain. So these neurotransmitters are involved in sleep and waking. They're also involved in responsiveness to the external world. In terms of drug development, many anti-anxiety drugs are agonists for GABA. Included here are drugs like Valium and Librium, which really do change the level of that medication, sort of bringing back down the anxiety level. I mean, think about it this way. Anxiety is a normal, healthy, functional emotion. We become anxious when we have reasons to be anxious. In anxiety disorders, though, that anxiety can be either too intense or too long-lasting, or both. So in some cases, what the agonists for GABA can do is to restore sort of the off switch for anxiety, bringing it down temporarily. Glutamate is the main excitatory neurotransmitter, meaning it increases the level of transmission in the nervous system. It's heavily involved in memory and pain, which you might think, well, those can't possibly be related. Well, there's an evolutionary reason why you want to link pain and memory. If something hurts you, you want to avoid doing it in the future. So they are connected. There are separate functions there, but they are interrelated. Having too much glutamate can actually destroy neurons. So it's desirable to keep that level stable. Not having enough glutamate, though, has been associated with the development and progress of schizophrenia. Now, to date, I have not seen a tremendous amount of research that shows specific medications that help with glutamate deficiency, but they are in development. Endorphins, which you may have heard of, especially if you are an athlete and you've ever been told about the so-called runner's high, or the high you can get when you're working out and you're working out really hard. Endorphins are neurotransmitters that are naturally produced in the brain that are designed to provide pain relief, but also the experience of pleasure. So they can sometimes be broadly described as the nervous system's painkillers, and they have some similar, although milder and not addictive, effects as the opiate medications that we've heard so much about in recent years. Endorphins, if you've experienced that feeling of euphoria and lack of discomfort and lack of pain that can happen when you're exerting yourself very strongly physically. This was, first documented in, long distance runners, but it's also been documented in people who lift weights and in lots of different sports, where you're really pushing the body hard, and essentially you're causing pain throughout your physical system, as well as the psychological system. You hit a point where those endorphins start to be released, and they combine with some dopaminergic activity in the brain to produce this experience of the runner's high. Now, drugs like morphine and heroin, they are agonists that actually will bind to the receptors for neurons that are designed to receive endorphins in the brain. So when people are taking morphine, or they're given morphine in the hospital, or they're taking heroin, which is a street drug that's an opiate, is essentially they're hijacking those receptor sites and really going at them much harder. And what this does, the reason why these drugs tend to produce a sense of euphoria and intense pleasure, is that they trigger what are called the reward centers in the brain. And those reward centers then simultaneously cause a big release of dopamine. So in addition to kind of mimicking and amplifying the experience of the endorphin, you're also getting a big flood of dopamine. So that dopamine piece is like, oh yes, do that again. Please do that again. I really like that. That's essentially what the brain is saying. And, that's the part of opiate addiction that is so hard to manage, because once the brain becomes accustomed to having the action on those receptor sites by these much more powerful drugs like morphine and heroin, or OxyContin, or any of the related opiates, then there's just never enough. So the combination of the euphoria and loss of pain that you can get, you also get this intense reward that kind of feeds into that cycle of addiction. One other thing to keep in mind about these drugs that we're all kind of aware of because of the opiate crisis that has been ongoing within our culture for a great deal of time, is that we often don't have good guardrails in place for intervening and stopping the delivery of these powerful painkillers, often for good reasons initially, like an injury, a surgery, something, where a person is in very, very intense pain. Certainly the opiates can, pretty quickly and immediately knock that pain down. But in fairly short amount of time, people can become dependent on those medications, and the withdrawal, the intense psychological addiction, the physical addiction, can make it extremely hard for people to stop taking those medications. And that concludes part 2 of my coverage of Chapter 2 Neuroscience for PSY 110S.